Imagine you're out with your horse. It's a beautiful day, but something just feels a little off. They seem a bit dull, maybe not quite finishing their feed. Or perhaps you've heard whispers, about some mystery condition where common backyard plants, things that look totally harmless, can suddenly become hidden, even deadly, dangers for horses. Welcome to The Deep Dive. Today we are plunging into a really critical and frankly quite alarming equine health issue: Heinz body anemia in horses. Our mission here is to equip you, our listener, with the essential knowledge so you can quickly get up to speed on this vital topic. We're going to unpack exactly what Heinz body anemia is, how it sort of systematically affects a horse's entire body, identify the surprising culprits behind it, and most importantly, show you how vets diagnose it, how they treat it, and crucially, how you can help prevent it. We've pulled all of this from, well, a whole stack of detailed veterinary sources to give you the most comprehensive, insightful exploration we can. Let's jump right in. So to really get a handle on the ripple effect of this condition, we have to start at the very beginning. What are Heinz bodies? Why is finding them such a critical red flag?
Right. So at their most basic, Heinz bodies are these tiny, distinct clumps of damaged hemoglobin that show up inside a horse's red blood cells. You can think of them as small, abnormal, sort of blue-black dots, often right near the edge of the cell. Seeing them is a clear sign the horse has been exposed to some pretty potent oxidizing agents.
Oxidizing agents.
Yeah. And the real problem starts once these Heinz bodies actually form. They physically damage the red blood cell's membrane, its outer layer, makes it rigid, dysfunctional. And this damage ultimately leads to the destruction of these vital cells. This breakdown, it can happen a couple of ways. Either directly within the blood vessels, that's called intravascular hemolysis, basically the cells bursting right there in the bloodstream.
Wow.
Or what's actually more common is that the body's own cleanup crew, specialized cells, recognize these damaged cells and remove them from circulation. We call that extravascular hemolysis.
So they're like tiny internal rust spots almost, making the cells break down. But how does this damage, this rusting from within, how does that actually happen at a molecular level? What's the process?
That's a great question. And that's where the concept of oxidative stress really comes into play. You see, a horse's red blood cells are, well, they're constantly battling these tiny damaging molecules called reactive oxygen species, or ROS. They're just normal byproducts of metabolism. But thankfully, the body has these brilliant protective enzyme systems, things like glutathione reductase and catalase, that act like internal bodyguards, neutralizing these radicals and stopping damage.
Right, a built-in defense system.
Exactly. But in Heinz body hemolytic anemia, these protective systems just get completely overwhelmed. It's like the defenses are suddenly swamped. This can happen if there's a huge overproduction of those ROS molecules, but honestly, it's far more often caused by exposure to potent toxins from outside the body, things the horse ingests.
Okay, so toxins overwhelm the system. Then what happens?
Well, what happens next is chemically quite interesting. The iron inside the hemoglobin molecule, which is normally in what we call a ferrous state, F2+, it gets oxidized. It sort of rusts, chemically speaking, changing to a ferric state, Fe3+, say. This forms something called methemoglobin. And this is really crucial because methemoglobin, well, it just can't carry oxygen effectively. So the tissues start getting starved of oxygen.
That sounds bad.
It is. And this oxidation also destabilizes the whole hemoglobin molecule itself, causing it to clump up. And this instability is key. It forces the hemoglobin to denature, basically unravel, and then precipitate, forming those characteristic Heinz bodies we were just talking about. In really severe cases of this oxidative damage, you might also see something called eccentrocytes. That's where the damaged hemoglobin gets kind of pushed all to one side of the red blood cell, leaving a clear zone on the other. It's another visual clue of really extreme stress on the cell.
Okay, so if I'm picturing this right, it's like their blood's oxygen-carrying machinery is literally short-circuiting or rusting out from the inside. Once these red cells are damaged like that, with Heinz bodies or as eccentrocytes, what happens to them? What's their ultimate fate? And how does that hit the horse?
Well, their flexibility, their ability to deform and squeeze through tiny capillaries, it's just severely decreased. They become rigid, stiff. So the main way they get removed is through that extravascular hemolysis we mentioned. Think of the spleen's macrophages, special immune cells, like tiny, super efficient security guards patrolling the bloodstream. They're specifically trained to spot and grab these rigid, damaged red blood cells, effectively filtering them out of circulation.
The spleen is working overtime then.
Absolutely. But in really severe cases, you can also see intravascular hemolysis. That's where the red blood cells just directly lyse or burst right there in the bloodstream. And that releases free hemoglobin into the plasma, the liquid part of the blood. And that free hemoglobin can then cause serious complications, especially acute kidney injury. It's a real cascade effect.
That cascade starting inside the red blood cells is clearly devastating. But how does this problem, initially microscopic, ripple outwards? How does it affect the entire horse? What other systems start, screaming for help?
That's what's so striking, really. How a problem starting with these tiny blood cells can just cascade through pretty much every major system in the horse's body. Because oxygen delivery is so badly compromised, you'll definitely see impacts on the blood, lymph, and immune systems. That includes the regenerative anemia. We talked about the bone marrow desperately trying to make more red cells. You'll often see an enlarged spleen, splenomegaly, because it's working so hard cleaning up the mess. And sometimes even a fever, pyrexia.
Makes sense. What about the heart and lungs?
Oh, absolutely. The cardiovascular and respiratory systems are under immense stress. You'll see tachycardia, a really fast heart rate, and tachypnea, rapid breathing, as the body tries frantically to compensate for that lack of oxygen. And the horse might also have very pale mucous membranes, gums, eyelids. That's a really consistent sign.
Okay. And the kidneys. You mentioned kidney injury.
Yes, exactly. If there's significant cell bursting in the bloodstream, that intravascular hemolysis, the kidneys are definitely at risk. You can see hemoglobinuria, that's hemoglobin, spilling into the urine, making it look red or brown, and all that free hemoglobin can seriously damage the kidney tubules, potentially leading to acute kidney failure. The liver, or the hepatobiliary system, can also take a hit. You might see jaundice or icterus, that yellowish tinge, because of the increased bilirubin from all the broken down red cells. And the liver itself can suffer damage from lack of oxygen.
Wow. Anywhere else?
We've even seen gastrointestinal issues like problems with gut motility, colic, again, probably due to oxygen deprivation in the intestines. And believe it or not, in very severe cases, even the musculoskeletal system can be affected, leading to laminitis, that horrible, painful inflammation in the hooves, again, likely linked back to poor oxygen delivery.
That is a truly complex and devastating chain reaction, just starting from microscopic damage. So given all this, what are the initial triggers? What causes this oxidative damage in the first place? What are these surprising culprits horse owners really need to watch out for?
This is exactly where prevention becomes so critical. A huge number of cases are actually due to plant toxicities. The classic cause, and honestly probably the most dangerous one, is red maple, specifically the species Acer rubrum. But here's the really surprising, crucial part. It's the wilted or dried leaves that are far more toxic than fresh ones.
Really? Wilted leaves?
Yes. They contain a concentrated compound, gallic acid, that causes this oxidative damage. So you might think a wilted leaf on the ground is harmless, but for a horse, a dried red maple leaf becomes a concentrated poison. It's a real hidden danger, especially common after storms or just in the fall when leaves are dropping.
It's definitely counterintuitive.
Another extremely common culprit, believe it or not, is onions, allium cepa, and garlic. Allium sativum.
But wait, some people feed garlic supplements, right?
They do, and that's the danger. With chronic feeding, or if they eat a really large amount at once, the thiosulfates in onions and garlic can cause Heinz body formation. This also includes wild onions and garlic grass that horses might graze on, especially in early spring when those might be some of the first green things popping up. Other related plants like chives and leeks are also risky. So yeah, something seen as natural can actually be quite dangerous in the wrong context or amount.
Good to know. Are there other causes besides plants?
Definitely. Certain drugs and chemicals can do it too. Phenothiazine derivatives like the tranquilizer acepromazine have been implicated, especially at high doses, though thankfully that seems less common now with more careful dosing practices. Copper and zinc toxicosis, usually from eating too much, maybe from contaminated feed or licking things they shouldn't, can also cause oxidative damage. Methylene blue, which is rarely used therapeutically in horses anymore, is a potent oxidant.
Anything else?
Well, very rarely there can be inherited defects. Deficiencies in certain red blood cell enzymes like G6PD or FAD can make a horse more susceptible. And it's also just worth noting that inherently, equine red blood cells seem to have slightly less developed protective mechanisms against oxidation compared to some other species, makes them generally a bit more vulnerable. Oh, and one other thing, sometimes thinner horses seem to be at greater risk for phenothiazine toxicosis specifically.
Okay, that is a lot of potential dangers to be aware of, some quite unexpected like the wilted maple leaves and the garlic. So if you suspect something is wrong with your horse, What are the critical clinical signs you should be looking out for? What really stands out to you when you're evaluating a potential case?
Right, so thinking about the history, what the owner might notice first. It could be exercise intolerance. Maybe the horse just seems suddenly dull, unusually lethargic, not interested in food, or even shows signs of colic. And sadly, in some really acute, severe cases, it might even present as just sudden, unexplained death. That history of potential access to wilted red maple leaves or other toxins is just a critical piece of the puzzle. It's often the first clue in our detective work.
And what about when the vet examines the horse? What do you look for?
On the physical exam, probably the most consistent and telling sign is those very pale mucous membranes checking the gums inside the eyelids. They might look almost white, but you'll likely also see general weakness, that continued lethargy, and increased heart rate, increased respiratory rate, sometimes even a heart murmur as the heart struggles to pump the oxygen-poor blood effectively. A fever can also be present.
You mentioned methemoglobinemia earlier. What does that look like?
Ah, yes. If there's significant methemoglobinemia, that's when the blood itself is changed because it can't carry oxygen well. You'll see those really alarming muddy brown or even bluish cyanotic mucous membranes. And the horse's blood itself, if you draw a sample, might actually look brownish instead of bright red. It's a very clear sign of severe oxygen deprivation.
Wow.
You might also see pigmenturia, that reddish-brown discolored urine we talked about. It's important to differentiate that from actual blood in the urine. Sometimes you might see changes in urination, less or more, if the kidneys are being affected. And on a rectal exam, we might feel an enlarged spleen. In really severe cases, unfortunately, horses can become ataxic, sort of uncoordinated, before potentially collapsing.
This sounds like it requires some serious veterinary detective work to piece all those signs together. So how do veterinarians actually confirm this diagnosis, especially with signs that could point to other conditions too? What are the smoking guns in the lab work?
You're absolutely right. It's definitely a combination of careful history taking, a thorough physical exam, and then, crucially, the laboratory findings. Once we've assessed the horse clinically and asked all those questions about potential toxin exposure, we move to the lab tests.
Okay, what's first?
The essential next step is a complete blood count, the CBC, and looking closely at a blood smear under the microscope. The CBC will show the anemia a decreased number of red blood cells. The packed cell volume, or PCV, which measures the percentage of red blood cells, is often dramatically low, sometimes even below 20%. And here's an important point for horses. It's usually a regenerative anemia. That means the bone marrow is trying its best to pump out new red blood cells to compensate.
How do you know it's regenerative in horses?
Right, because unlike many other species, horses don't readily release the immature baby red blood cells, called reticulocytes, into circulation. So we don't see those easily on the blood smear. Instead, what tells us the bone marrow is trying is finding macrocytosis, meaning the average red blood cell size is larger than normal, and anisocytosis, which is just variation in the size of the red blood cells. If there's any doubt, a bone marrow aspirate can confirm regeneration.
Got it, but what's the definitive proof?
The true hallmark, the thing that really confirms Heinz body anemia, is actually seeing the Heinz bodies on the blood smear. While you might sometimes spot them on the routine stains, they show up best with special supervital stains like new methylene blue or brilliant crescel blue. Under the microscope, they appear as these distinct little blue-black dots or precipitates inside the red blood cells, sometimes even looking like they're poking out from the cell edge. Seeing those is diagnostic.
Ah, okay. The smoking gun?
Exactly. We might also see those ascentrocytes we mentioned earlier, and often there's an inflammatory leukogram, meaning changes in the white blood cell counts, often with an increase in neutrophils.
What about blood chemistry?
Serum biochemistry usually shows increased bilirubin, both total and indirect, from all that red cell breakdown. You'll often see elevated liver enzymes indicating liver damage from the lack of oxygen. And azotemia increases in kidney values like BUN and creatinine, which points towards kidney issues, either from dehydration or direct damage from that free hemoglobin.
And urine test.
Urinalysis will typically show that hemoglobinuria, the urine, tests positive for blood on a dipstick, but when you look at the sediment under the microscope, there are no actual red blood cells. That confirms the pigment is hemoglobin, not blood. Proteinuria can also be present. We might do other tests too, like co-oximetry to measure the exact amount of methemoglobin, or check red blood cell osmotic fragility, or use ultrasound to look for that enlarged spleen or liver. And of course, it's really vital to rule out other things that can cause similar signs, like immune-mediated hemolytic anemia, equine infectious anemia, or even certain tick-borne diseases like pyroplasmosis or anaplasmosis.
Okay, so a horse gets diagnosed with Heinz body anemia. What does treatment actually look like? It sounds like time is absolutely critical here. And what's the ultimate outlook for these animals?
Treatment is, well, it's largely supportive. There isn't really a specific antidote or therapy that directly targets or removes the Heinz bodies themselves once they've formed. So the immediate and honestly the most crucial first step is to remove the horse from whatever caused it. Get them away from the toxic plants, stop any suspect medication, remove them from the contaminated environment. That has to happen right away.
Stop the exposure. Makes sense. Then what?
Then supportive care becomes paramount. We start aggressive intravenous fluid therapy, usually with balanced isotonic crystalloids. This helps maintain blood pressure, improves blood flow to the organs, especially the kidneys, helps prevent further kidney damage from that free hemoglobin, and helps flush it out. For severe anemia, especially if that PCV drops below, say, 8 to 12%, or if the horse is showing signs of shock or severe weakness, a blood transfusion, either whole blood or packed red blood cells, might be absolutely necessary, even life-saving.
Wow, blood transfusions.
Yes, it can get that serious. Oxygen therapy, maybe via nasal cannula, can be helpful if there's severe hypoxemia, severe lack of oxygen. We also recommend strict stall rest to minimize the horse's oxygen demand, and offering really palatable feed to encourage them to eat and keep their strength up. Oh, and if we suspect toxin ingestion was very recent, we might pass a nasogastric tube and administer activated charcoal and mineral oil to try and reduce further absorption of the toxin from the gut.
What about antioxidants? Do things like vitamin C help?
That's a good question. Antioxidant therapy, things like vitamin C, ascorbic acid, or N-acetylcysteine, NACC, they might be considered as supportive measures. The idea is to help combat the ongoing oxidative stress, but their proven efficacy in directly reversing already established Heinz body formation is pretty limited. We might use them, but they aren't miracle cures.
Okay. Are there any treatments to absolutely avoid?
Yes. And this is critically important. Methylene blue therapy, which is sometimes used for methemoglobinemia in other species, is contraindicated in horses with Heinz body anemia. It can actually worsen the oxidative damage. And corticosteroid use is also generally not recommended and has even been associated with decreased survival rates in these cases. So those are two big don'ts.
Good to know. So what's the prognosis overall?
It's really highly variable. It depends heavily on how severe the anemia is, what specific toxin was involved, and how much was ingested, whether serious complications like kidney failure or severe organ damage have already developed, and crucially, how quickly effective treatment was started. Unfortunately, for horses with red maple toxicity specifically, the prognosis is often guarded to poor. Studies have shown a fatality rate of around 60%, which is incredibly high.
60%. Wow.
Yeah, it's very serious. Even for horses that survive the initial crisis, recovery can be quite prolonged. It requires really close monitoring of their blood work, like the PCV, their kidney function, and keeping a very close eye out for potential long-term complications like laminitis developing later. It's a tough road for many of them.
Given that sobering prognosis, especially for red maple, it really drives home the point about prevention. If we connect this to the bigger picture, prevention seems absolutely paramount. What proactive steps can you, the horse owner listening right now, take to protect your horse from these often hidden dangers?
Prevention truly is the absolute key. There's no question about it. First and foremost, pasture management. It is vital to identify and, if possible, physically remove red maple trees, especially that dangerous Acer rubrum species, and also things like wild onions or garlic from pastures and any surrounding areas where horses might have access. And be especially vigilant about fallen branches or leaves, particularly after storms or in the autumn. Remember, those wilted leaves are the most toxic. A simple gust of wind can suddenly turn a safe pasture into a danger zone.
So really inspect those pastures carefully.
Absolutely. Then, thinking about feed management, always ensure any commercial feeds come from reputable sources and are free of contaminants. And going back to our earlier point about supplements, be cautious with garlic or other allium-based supplements. While they're commonly used, the potential for toxicity definitely exists with high doses or chronic intake. Talk to your vet before adding anything like that. And maybe most importantly, educate everyone who interacts with your horse barn staff, friends, family, to avoid feeding human foods that we know are toxic, like onions and garlic from the kitchen. It's amazing what well-meaning people might offer as a treat.
That's a great point. What about medications?
In terms of drug administration, if phenothiazine-based tranquilizers like espromazine are needed, ensure they're used at the appropriate veterinarian-prescribed doses, and always monitor your horse for any unusual reactions after any new medication is given.
Okay. Anything else environmentally?
Yeah, just maintain good environmental awareness in general. Look around barns and pastures. Identify and remove any potential sources of heavy metal contamination, things like old car batteries, improperly stored chemicals, even certain types of old fencing or building materials coated in zinc. Taking these proactive, informed steps can make a profound difference. It could literally save your horse's life.
It really is fascinating, isn't it? How a seemingly benign plan, like that wilted maple leaf, or even a common supplement like garlic, when it's misunderstood, can harbor such a potent threat. It just reminds us that knowledge isn't just power, it's protection. So, what unexpected dangers might be lurking in your environment, maybe waiting for a second look now that you're armed with this crucial information about Heinz body anemia? Something to think about.